Can be easy to forget, but it is very important to keep your heart health in mind during the winter months.
So KCU Assistant Professor of Primary Care, Dr. Benjamin Grin, is joining us this morning with some signs and symptoms of heart disease. Good morning, Dr. Grin. Thanks for being here. We know heart disease is the leading cause of death for men and women. So I guess let's start here. Why do so many people underestimate the risk?
You know, I think thank you so much for having me on the show.
Of course.
You know, I think many people assume that just because they feel well, their heart is healthy. Some people assume that, you know, heart disease only happens in men or it only happens in people who are much older. The reality is that heart disease is something that develops over years and years, and things like smoking, poor diet, lack of exercise can accumulate that risk over time.
What are some symptoms of a heart attack that we should be on the lookout for? And is it different for men and women?
Great question. You know, the classic symptoms of a heart attack that we think about are like that crushing chest pain in the left side of the chest that can travel to the arm or jaw. Men are more likely to experience that classic chest pain syndrome. Women can also experience that syndrome, but they may be more likely to experience more atypical symptoms like fatigue or shortness of breath, or maybe pain in the upper abdomen as well.
Yeah, I did see that recently, that the symptoms can be different for men and women. Very interesting. And so what are some things, I mean, obviously this is the time of year we were just saying off air, we're all kind of noshing on treats at work and probably overindulging at all these holiday get-togethers. What are some things we could do to look out for our heart while we're gorging on all the sweets?
I mean, none of us are perfect, you know, but I think some of the things we can do to help protect our heart, you know, one is see your doctor, get checked out. You want to pay attention to your blood pressure, your blood sugar, and your cholesterol. There are things that you can do both in terms of your lifestyle, maybe not around the holiday season, but at other times of year in order to address those, as well as medications. Also, don't smoke, and if you do smoke, you know, talk to your doctor about trying to quit. Exercise regularly. Recommend about 150 minutes a week of moderate intensity exercise for everyone. And the last piece would be, you know, just talking to your doctor about your personal risk for heart disease. You know, there are medications and also lifestyle factors that you can take on that can help reduce your risk.
I know we're kind of living through an unusual time right now with how warm it is outside. It's good for us to be able to get out there, but can you tell us how the colder weather can impact our heart health?
Yeah, great question. And, you know, something that people often ask me about is shoveling snow, and is that safe with your heart?
Heart attack snow.
Yeah, heart attack snow, and it is a real thing. So, you know, cold weather affects the heart because cold weather causes blood vessels to constrict, and that puts extra stress on the heart. With shoveling snow, you know, first of all, you've got that effect of the cold weather on the heart already putting strain on the heart, and then you've got folks taking on a very intense, sudden physical activity. And a lot of folks who are shoveling snow, you know, may not be regularly physically active during the year. And so in someone that, you know, already maybe has underlying heart disease and maybe they don't even know about it, you know, shoveling snow can be that kind of inciting factor for a heart attack.
And how about like some, you probably already mentioned it, Dr. Grin, diet tips, like things, fish oil, I hear is good?
You know, it depends on the type of fish oil. So, you know, I recommend folks talk to your doctor about that one before just buying the over-the-counter fish oil. But in general, some diets that are shown to be healthy for the heart include, you know, low-fat diets. Also, you know, diets that are high in fruits and vegetables, and, you know, diets that are high in lean proteins like chicken and fish.
And turkey. I know that's one thing that's been helping me out right now. It's just that balance. When would you say is a good time to seek medical care?
You know, in general, you know, if you're ever experiencing symptoms that you're concerned are symptoms of a heart attack, call 911, see your doctor right away. But I also tell all my patients just to pay attention to your own body, and if you're experiencing anything that just doesn't feel right for you, always a good idea to get checked out.
All right, great stuff, Dr. Benjamin Grin. Thanks so much for coming in on Christmas week.
I know, we really appreciate you being here.
Thanks so much for having me.
Absolutely.